Hey everyone! Today we're going to look at a small topic that has gained a lot of attention recently: Brucella. It is a small cocobacilli, means a very short oval shaped rod. It is pink in color or gram negative. Its hands and legs have been tied up, indicating that it is non motile. It loves oxygen and is an aerobic organism. It is non capsulated and non sporing. It is important to remember that it is a strict parasite of animals only. Brucella spreads through direct or indirect contact with infected animals and their products, of which milk is the most common. Brucella is killed by heating the milk at 60 degrees for 10 minutes. If the milk is unpasteurized, Brucella can survive in it for a long duration of time. People who work in close contact with animals, such as butchers, farm workers, veterinary doctors, are at high risk of contracting the infection. Along with this, lab workers coming in contact with the organism can also get infected. It is important to remember that man to man transmission of brucellosis is not possible. This is a commonly asked multiple choice question. Brucellosis is a disease of the reticuloendothelial system. Its incubation period ranges from a few weeks to several months. It is characterized by a classic triad of nocturnal or night fever, joint pains or arthralgias, and hepatosplenomegaly. This condition can also be called Malta fever, Mediterranean fever, undulant nocturnal fever, which means fever that rises and falls throughout the night, and a less severe typhoid like fever. All of these names can be used to confuse you in competitive exams, so try your best to remember them. For the laboratory diagnosis of brucella, blood is collected in the pyrexial phase. It is cultured by Castaneda's method, having liquid and solid soy agar media. If you see the word Castaneda's method in a question, brucella should be your first thought. Serum agglutination is the gold standard test used to diagnose brucellosis by the IgG and IgM immunoglobulins. Brucellin hypersensitivity test is an intradermal test used for the diagnosis of chronic brucellosis. Brucellosis is treated using a combination of tetracycline or doxycycline along with streptomycin. The WHO recommends a 6-week long regimen of rifampicin and doxycycline. To protect yourself from brucella, protective gear should be used when working in close contact with animals. Milk and milk products should always be pasteurized before consumption. It is advisable to vaccinate all animals for brucellosis. For the diagnosis of brucellosis in animals, the milk ring test, rose Bengal card test, and whey agglutination tests are used. A growing worry among the population is the association of brucellosis and fertility. Studies have found that it affects reproduction in only 2 to 10% of the human patients. In males, it can cause epididymorchitis, and in females, it may lead to spontaneous abortion. I hope this video has taught you everything important about brucella. Don't forget to subscribe to our channel.